If you think about it, it's pretty unique that the University of Missouri has a medical school, a law school, and a veterinary school all on the same campus. In addition, they have a large academic medical center with a full array of graduate medical education programs.
The fact that we have the University Hospital embedded in the University of Missouri with the School of Medicine adjacent, we have a School of Nursing. It's so rich in terms of the kinds of learning that we're able to do from each other clinically and beyond our clinical activities.
So we have a full array of educational experiences to offer our trainees here. We have grand rounds, we have morning report, we have noon conferences. All of our divisions also have their own divisional grand rounds and subspecialty lectures that they give as well. I think the combination of the larger academic medical experience in a sort of smaller, tighter knit community is really unique.
We have a pretty big residency program. We have a lot of subspecialty fellowship programs. So we're surrounded by people who are learning, who are generating new knowledge, and are here to take great care of patients.
We are a large academic medical center in a medium-sized town, and we have this great combination of, a great variety of clinical cases coupled with a great lifestyle. So we really are the medical center for the state of Missouri. We get referrals from all the corners of the state. And that really gives us a nice combination of sort of the routine cases that we get from our own community and the immediate surrounding area, as well as the more interesting cases that get referred in from elsewhere.
Our three organizing focus areas are clinical excellence, exemplary education, that's why people come here to learn, and exemplary research. The care of Missourians and discovery that lets us affect the care in a positive way for people beyond Missouri is why we exist as a land-grant School of Medicine. I think we're a really nice balance between a big enough program to have the diversity of people, of ideas, of experiences that we need for a really strong residency program and really strong fellowships, but small enough that you're not going to be a face in the crowd. People will know you, people will see your work, people will follow up with you.
The most important thing to me is that no fellow who graduates ever feels as though they are incapable of taking care of someone.
To me, wellness is more of providing a supportive environment for the people that work there, and so it's about trying to engage people, making sure that we're listening to their concerns, acting on those concerns when we can, understanding that each of our trainees is a unique person with unique circumstances that sometimes requires a unique response. Don't really believe in the cookie-cutter approach to personnel management, and more understanding that everybody comes to this with a unique set of experiences that has to be dealt with in an individual way.
When I first started residency, you hear all these horror stories about, oh, it's going to be scary and you're going to work all the time, you're going to have people yelling at you. That was not at all how it went. Everyone was very welcoming.
The culture here is so friendly. That's one of the things that kind of drew me to Mizzou the most. When I came here for an interview and got to meet a lot of the residents, I knew that I would feel at home. Everyone was so fun, they seemed really happy, and I thought that was a huge thing that was important to see how all of the residents here feel like the program is for them.
I wanted to get good training coming in, but when I showed up for my interview, there was just such good aura and amazing group of people that was really the deciding factor for me to do residency here at MU.
We have this culture that I feel that of helping each other out, and other residents are usually very happy to kind of help with some of the workload. All it takes is one person to jump in and say, hey, I can handle this one thing for you, don't worry about it. And then that kind of culture, I think, goes throughout the program.
During the Continuity Clinic Week, 2 half-days are dedicated to ambulatory didactics, quality improvement, and board review. Each Continuity Clinic Week also has at least 1 and often 2 half-days completely unscheduled, allowing residents to attend to personal matters that can only be accomplished during regular business hours.
But when you decide, I'm really interested in this area, I want to go deep, and I want to partner with someone in order to do so, you're going to be able to do that.
We have a cardiology program, we have GI, we have HEMONC, we have all the big ones. We even have some subspecialty, such as interventional cardiology, and we have sleep medicine.
We have full spectrum services, and we have great collaborations with organizations within a few hours, east or west, to provide those very specialized services when needed. If we have something that I don't know the answer, I can ask the question, I know the right person, and I'll get the help that I need. I can ask that question and get that specialty consultation.
I do feel that I have the autonomy, especially on call days or night rotations, when attending is available if you need them, but they're not right there with you, and you have to make your own decisions quick. But if you need an attending, they're a phone call away.
Our residents get to see our cases from when they present to when they are discharged back to home.
We do so in a way that ensures patient safety. So it is autonomy with the appropriate supervision and oversight from the attending physicians who take that responsibility really seriously. Equally responsible for the readiness of our graduates to practice independently.
We believe that feedback is crucial for resident development, so we arrange for our residents to meet with their advisors quarterly to get more real-time encouragement and course correction if needed.
Our catchment area is very large, kind of extending from St. Louis to Kansas City, and so we get a lot of very interesting cases from the rural areas in the surrounding Missouri that come to us for health care, and I think that provides an opportunity for us to see a lot of those kind of zebras that some other smaller hospitals don't get to see.
Since our hospital does serve the City of Columbia as well as operates as a tertiary care referral center, we see your run-of-the-mill cases like diabetic ketoacidosis, COPD flares, heart attacks, things like that, as well as sort of the oddball cases that get referred in from the far corners of the state. Strange cancers, interesting infections.
Rare tick-borne illnesses. Missouri is somewhat famous for ehrlichiosis. These are things that a lot of people, I feel like, only get to read about, and we actually get to treat those things here. And of course, all manner of different heart disease and lung diseases.
So I've done lumbar punctures, I've done central lines, I've done paracentesis, thoracentesis, I've done a number of intubations as well.
So I personally am credentialed to do paracenteses, thoracentesis, lumbar punctures, central line placements, arterial line placements, incision and drainage. We'll do pap smears and all kinds of things. We'll do some basic wound care. So really a pretty good spectrum of things that I think are very valuable for internists.
Our residents have ample opportunities to perform procedures should they want to pursue them, and our residents are trained in the use of bedside ultrasound to ensure that they can perform them as safely as possible. Conversely, if residents are not interested in performing procedures, our hospital has a procedure team that can be called to perform procedures at the bedside, as well as interventional radiology if that is the more appropriate option. Our program offers a variety of educational opportunities, including morning report 3 days a week, noon conference 4 days a week, and internal medicine grand rounds weekly. Each subspecialty has their own specialty-specific series of lectures that residents are welcome to attend. Our noon conference series follows the ABIM blueprint to ensure that key topics that will be tested on the ABIM exam at the end of your training will be covered. Our program follows a 4+1 continuity clinic model, which minimizes the conflict between inpatient and outpatient duties.
Lots of learning opportunities that are formally structured through the residency program. I think at least as important, probably more important, are the less structured learning opportunities of, I have a really interesting patient and I need to talk to somebody about this, and I do. I get more ideas from them, we talk, we figure out what gaps in knowledge we have. We have great resources in this library and elsewhere to enrich our own knowledge about a particular patient, a particular condition, a particular question.
We do morning reports 3 times a week in the morning where we discuss an interesting case that's been on the wards for the last week or so, and it really provides a great opportunity for the residents to work on building a differential, managing some complicated patients, and learn from each other's experiences. Our noon conferences are a little bit more structured towards board review. We put a lot of emphasis on making sure that our residents are very prepared for boards, and we do that through our noon conference lecture series.
If a resident wants to pursue academic things like conference presentations or poster presentations or get something published in a journal, we have faculty mentors who can help with that, and a lot of our residents actually do have quite a bit of academic experience that they build here.
One of the benefits of having so many fellows here is that they're always looking for help for research projects. And so I always encourage the residents to go to the fellows first and ask them if they have any projects going on. They have a lot of things that they're doing in their fellowship, and they always appreciate the help.
We've had residents who have come out of their residency program with 10 to 12 publications and an NIH grant. We've had other residents who have just chosen not to pursue research, and that's fine too, but the opportunities are there if you want them.
We are building a brand new research institution to fund the research. We have a lot of clinical trials that are going on as well. We do a lot of NIH grants, and I think that's one of the ways that we can not only give back to the community here in Missouri, but also give back to the medical community all over the country.
Many of our residents do go on to serve as fellows here too.
Our fellowship programs, generally speaking, want to have our residents in their fellowship programs. Our institution does get very invested in our trainees because not only are they people who have come here for an education, they are also potential future faculty members, and so we do like to keep them on board when we can for their fellowship training as well. The University of Missouri has a full array of fellowships in medical subspecialties. Additionally, we schedule each of our residents for at least 2 weeks of clinical experience in each of the subspecialties during their residency training, ensuring that your experience is broad-based and well-rounded. Certainly, a lot of our residents do choose to stay here for fellowship training, but the ones who choose to pursue fellowship opportunities elsewhere have been placed at a lot of different facilities across the country. We've had people go to UCLA, we've had people go to Creighton, we've had people go to the University of Tennessee.
When they graduate their residency, they are ready to be unsupervised in practice. Now, some choose to continue that supervision in an additional training with fellowship training, but our obligation is to make sure that our residents are ready to be autonomous by the time they leave, and that they're practicing that throughout their senior year or years in residency training. It's just a really wonderful size and balance between all of the energy and excitement and forward thought of an academic medical center with a place that's easy to live.
By having the university here, it brings in enormous amounts of diversity and other opportunities to explore things that you might find only in a bigger city.
I do love this town. It has a charm to it. I feel like people they smile, when you meet them. And I've been to many big cities and you don't have that, that friendliness.
There's a huge network of trails for walking, running, biking. There's local breweries and a vineyard. There's some distilleries around.
I can go canoeing, kayaking, bike riding, right from my house.
We have 4 kids and our public education system is top-notch.
Much of Columbia is focused on education and healthcare. Because of that, we draw more culture to Columbia and have more of a cosmopolitan feel than other towns our size.
You're going to have most of the big city amenities, theater, ball, we have Division I in athletics, of course, the Missouri Tigers, members of the SEC Conference.
We're looking for people who are curious, who are flexible, who don't expect everything to be the way it is today and want to be part of that change. People who demonstrate curiosity, flexibility, and also just a deep and unfailing commitment to their patients.